Hello everybody, thank you so much for joining. This is the first of the peer support sessions, ACT Together. I'm super happy to be able to bring this to you. Certainly when I first started learning ACT, finding a group of people, a group of clinicians that I could just like share some of my my thoughts with and some of the things I was struggling with and sort of in a safe place explore how to integrate ACT into my practice. So I'm really glad to be able to share this with you. um so a little bit about me. My name is Laura Rathbone. I'm an advanced neuromusculoskeletal physiotherapist, and I specialize in working with people who are experiencing the more sort of complexly presenting pain conditions. And acceptance and commitment therapy has been a part of my practice now for about 7 years. Um, yeah, so I've been exploring it. I worked within an ACT embedded pain management team in London in the UK, which was an awesome opportunity to learn alongside psychologists, occupational therapists, anaesthetists, nurses, all and also physiotherapists, of course, all sort of working together to produce a sort of collaborative and consistent approach to pain management. So that was a huge learning curve for me. um, I'm a consultant on complex cases, and I also consult with multidisciplinary teams and monodisciplinary teams as they sort of shift their practice and pain care towards biopsychosocial framework, and integrating ACT particularly. So I am an ACT trainer. So one of the reasons why I offer this peer support group is because I teach a course, which means I have um, a lovely network of clinicians who are now all out there integrating ACT into their practice, and this is also a safe place for them to come and discuss their cases and their challenges. And I'm a lecturer, so I teach on undergraduate physiotherapy courses and on postgraduate clinical psychology courses as well. So again, hello. So again, hello, welcome, thank you for signing up, thank you for being part of this support group, and for giving your time. Just to let you know that we are recording, so the introduction will be recorded, the breakout rooms won't be, and then when we come back, that sort of feedback session and any questions that come up and discussion that comes up after the breakout rooms will be recorded. And that's just a way of jogging your mind and your memory if you were here, and also a way for people to get a bit of insight into what we're doing and hopefully just continue to increase access to acceptance and commitment therapy. So you will be split up into breakout rooms where you'll be able to sort of figure out who's brought cases or who's got questions that they want to discuss, and you can decide which one you want to work on in that particular time. There'll be about 20 minutes for you to discuss in total, so sort of 5 minutes introductions and figuring out, then 15 minutes getting down into the discussion. And when you come back, maybe just have one person that's going to feedback or bring up any questions that were still lingering or anything like that, and we can open that up to a wider group discussion. Yeah, so hopefully that's useful. The chat. So the chat will be open throughout the whole of the introduction and the whole of the session. So if you've got any comments, thoughts, research that you think would be useful, bang it in the chat. That'll be really helpful. It will be really difficult for me to monitor, especially as if the group is large. So we're a small group today, but if we're a larger group, that's hard for me to monitor. So just be aware that I might not be able to respond to everything in real time. And there will be an opportunity to ask questions when you come back. So what is my motivation for doing this? Because obviously I am financially invested in the increasing access to acceptance and commitment therapy. I do teach a course on it. So obviously this is an opportunity for me to spread awareness about what the work I'm doing and what drives me and what I think has been helpful in my sort of like journey figuring out how to integrate ACT with physiotherapy, particularly pain therapy. But it's also really just an opportunity to grow a network and a community of clinicians that are working specifically in pain, and integrating ACT. So that's also another thing, and also to introduce you guys to each other. So one of the things that I hear on my course or when I'm lecturing is that, you know, it's just really hard to find people to talk about this with, especially if you're working out in let's say community or MSK based work or private practice, where you don't have a psychologist on hand, or you don't have other clinicians working around you. So it's just another way for you to meet people, because that's super helpful and super useful, something I found really helpful and useful. So I will be doing ACT together once a quarter. So the next one will be in March. But I am going to be sharing more free webinars and free content over this next year as well. So next month, I'm going to be taking a sort of very brief phenomenological approach, an ACT approach to understanding therapeutic alliance and how we can facilitate that experience in the clinic, because we can facilitate therapeutic alliance and we can sabotage it, but I find it really interesting that this therapeutic alliance, this connection between people, but really also very specifically between somebody who has been designated a healthcare clinician and somebody who is struggling with some kind of internal personal experience, be it you know, emotional psychological distress, or the experience of pain, or whatever it is. But specifically this combination seems to be able to help people to overcome really difficult experiences. I find that pretty mind-blowing, really. So I want to just like have this opportunity to share some of the work that's helped me make sense of that over the last few years. So if you're signed up to this, you'll get an email with a link through anyway. But if you didn't come to this session and you didn't sign up and you're watching this back on record, then you might want to head to my website, laurarathbone.com, and sign up for updates, where you will then get an update email inviting you to register for that, and that will be a free webinar as well. There will be one every month, but I haven't figured out what I'm going to talk about in February. Yeah, it'll probably come to me in January. In March. Okay, so just to add a little bit of, you know, value, although I think this is already a very valuable thing to do, I thought what I would try and do every session is just pick a couple of papers that I've thought have been interesting to my ACT practice, and try and stay on topic, which is always a little bit difficult for me, but trying to stay on topic. So this week I read two papers by Vowles, in collaboration with other excellent researchers and writers. So the first one that I was going to share with you is one from the Journal of Contextual Behavioral Science. So this is Amanda Rhodes, Stacey Martin, Joel Guarna, Kevin Vowles and Tarrant Allen. And they looked at how we can modify or incorporate some of the current contextual experiences of the people we're working with, particularly thinking around COVID-19 and the pandemic. So this paper is just really lovely as a starting point. So first of all, there is also an echo of this paper just adds to some of the one of the papers that was recently brought out by Prof. Mick Thacker and Mike Mansfield on the potential physiological risk factors for persistent pain for people who have experienced COVID-19, but also people who are experiencing persistent pain may be more at risk of COVID-19. So there are a few things that are overlapping here, and also this particular paper, the Rhodes paper, highlights that people who are experiencing persistent pain are already high risk of the sort of psychosocial impact, that biopsychosocial, but focusing more on psychological and social isolation that can be caused. That is being sort of seen around the world with regulations and restrictions around COVID-19. So it's just another way for us to be flexible and acknowledging that, you know, although we might be seeing people for pain, they may also be dealing with difficulty navigating and managing the pandemic as well. So they write that this is an opportunity for us to frame psychological flexibility work within both a pain frame and the pandemic frame, which I think is just a nice reminder to keep remembering that the patients that we work with, the people we work with, are not just in a pain bubble. They're in a wider system that is having an influence. And they talked about pragmatic tips like how introducing virtual care is an opportunity for us to model flexibility and willingness and acceptance of unpleasant experiences, and also explored ways that we can manage our visual space, so this space of the Zoom contact, in the same way that we might manage the clinic space, and how we design the clinic space. So that's also an opportunity for us. And then they talked about incorporating pandemic related concepts into your metaphors, which I hadn't really thought about explicitly, but probably was starting to incorporate them implicitly. Things like and they give the example of the mouth cap being a bit like the mask that we wear, and how it can cover some of our internal experiences. And it certainly does have a cover some of our nonverbal communication, which is interesting as well. So if you're looking for a nice easy read with some pragmatic tips and just some thinking sort of platforms for you, that's a nice little paper. And then the second one I read, one of the papers I read this week around ACT was by Vowles again, but in collaboration with Eric Kruger, Robert Bailey, Gail Soden, Julie Ashworth, Jane Hickman, and Lance McCracken. So this paper was looking at the chronic pain acceptance questionnaire and whether we can reduce it from a 20-point questionnaire or an 8-point questionnaire, which is already out there as, down to a 2-point questionnaire. And so if you aren't using the chronic pain acceptance questionnaire, this is an opportunity for you to go and explore that, because it's out there and could be helpful in your practice. The CPAC can be both an assessment tool and a monitoring tool, and it's also a way of us figuring out if pain interference is reducing without having to do the pain interference questionnaires. So it's because as we see increasing pain acceptance, that's correlated with reduction in pain interference. So it's quite a useful assessment if you're not already using it. Bringing it down to a 2-point option would, I think, be like really nice for us, because it will give us a kind of measurability whilst also facilitating space in the therapeutic encounter for sort of free conversation without having to go through the questionnaires. At the moment, sometimes what you might do in your clinic, and if you don't send them out digitally separately, you might be using your clinic time to go through the questionnaires, which can be really fatiguing for the person and just take up a lot of time in your clinic. But if we can reduce that all down, we can still get the information that we want through our conversations, but we're also getting that measurability of the 2-point questionnaires. I think that would be really exciting. Hasn't been validated yet at this, but it's just in the beginning phase of evaluation. So I think that would be really nice, and it's just a little thing that's come out recently that might give you something to add to your clinical practice as well. So that is 2 things I've read, and I will put a link to those on the YouTube video. So if you are watching this back, you will be able to see those links as well. So let's think about getting started. So in a few moments, I'm going to just click breakout rooms and open the breakout rooms, and you'll be able to go off and have your discussion, decide on your case or your problem or your question, and then I will bring us all back and we will continue the discussion in the main room. Please make sure that you maintain the anonymity of the cases you bring. That is, obviously that's your responsibility, and also clinicians, if we could respect the anonymity of the patients, and enter into the spirit of acceptance and commitment therapy, which is open source sharing and just trying to help people integrate this into their practice. So have a lovely chat. I will be popping in and out for a few minutes just to help facilitate it or answer any questions, and then I will see you back in the main room. So I will just put you to breakout rooms, and then I'll see you later. More fails.
Are we back in the main room? I'm not sure.
We are back in the main room. You are back in the main room, and I apologise we did overrun on the breakout rooms, but I think that everybody was getting something useful out of them, and it's. And so, how was your discussion? Is there something that you want to feed back, or is there anything that came up where you thought, oh, that's really interesting, and maybe if I share that with the group, it will help others in their practice or their decision making, or is there any leftover questions?
To basically to start, yes, exploring. Lucy suggested a very motivational interviewing style, brilliantly. What the people around her, family members, friends, people who interact with her, think about her pain. How do they behave with her? What do they tell her? What she tells them. So basically, what's the narrative behind the symptoms she's having, and what is their view of the problem she's having, because that could be something helpful to use on my side, like, for example, you should focus on other things, or that instead could fuel some of her beliefs, because they may tell her, you know, you must check that knee, something must be wrong, you're right. So yes, to start exploring with her, and possibly in a session, even with some of his, one of his person together, what is the narrative behind, basically. That I found could be helpful. Lucy, do you think is what we discussed about?
I think, well, two things. First of all, I think it was Kate that originally suggested that, so credit where credit's due. We sort of both elaborated on that idea. I suppose the other thing is, yes, motivational interview is important. I've forgotten what my other point was going to be then. I think, oh yes, that's right. But as an occupational therapist, it's easier to ask about all of the other kind of aspects that the pain affects. So physios, I think, you know, it's hard because people have a certain expectation. They think, you know, they already know what physios do. So if a physio starts asking about all these other areas of life, it throws people. Whereas occupational therapy, we introduce ourselves by saying, this is what we do, and we'll look at kind of all aspects of your life. So it's kind of, we almost have a bit more permission to go into these different areas. And that helps us to elicit people's beliefs a bit more easily. So I think that's where we have a bit of an advantage, really. But yeah, I definitely think sort of that exploratory conversation about how does this affect your relationships and what do people say, and then writing down some of those quotes can be quite powerful to get her to reflect on them.
Yeah, I think systems-wide approaches to thinking about, well, what is feeding in, what in the wider system is feeding into these beliefs, or at the same time might be feeding into a feeling of not being seen, or a feeling of not being believed, of not being just like, of their pain reporting or care seeking is somehow not justified. And that can also maybe give us a little bit of insight into why somebody's holding so tightly to this experience, or getting hooked so strongly, to use more sort of ACT terms. Could help open that up. And actually, Lucy, it's a lovely point you made about the fact that actually there are quite high expectations on physiotherapists to stick to the tissues, and only the tissues that are in the clinic, so not the tissues that are outside of the clinic. But sometimes I find that is one of our advantages as well, because it's so sort of like, it creates content in the room, it brings emotion into the room, and that's what we're looking for with that. Well, what comes up when we do something like this, and how can we work with that? So there's pros and cons to this. Nice little reflections. Lovely, thank you. Would somebody else from one of the other groups like to feedback what you guys were talking about? If somebody just wants to take the lead. Oh, Janet, you're on mute. I think you stepped up to the plate. Thank you.
We chatted about a patient of mine. I'm really quite new to ACT, and I guess I've been a physio quite a long time, so I'm experiencing the shift you talked about. And we talked about sort of a patient I've seen just 2 times who presented with back pain, and I've just seen her twice, and with all my new ACT thinking, really. So I've been trying to fit the framework and fit all my chronic pain and into it, and we've started to sort of, with the self and the idea of her still as a person, and sort of started to work on the present, and this idea that she's somebody with pain, and sort of started to try and work on that idea of diffusing things a little bit with her, and what else really, and started then to introduce pacing and walking, and an idea of starting to get out and introduce some of the values like cooking with her kids and getting creative. So it's very much at the beginning, but as we chatted, I think it just so helped to actually speak to the others and to get an idea, because I think it is quite overwhelming. I'm finding it quite overwhelming just to get it into things to a point that I'm just working with, really. So we talked about the ACT matrix, and that just it's getting the focus back, isn't it? And like where you mentioned about it's maybe not so much about each event that happens, but what's the process happening within that, and the choice making, and sort of breaking it up a little bit. So that was just really helpful, just to bring me back in a sense, you know, because I think it's quite hard not to get overwhelmed with the patient and head off on some little journey with them.
Yeah, absolutely. That really resonates with me as well, and I think it's something we talk a lot about when we're training as well, is this sort of noticing when you're being pulled into the sort of that confusion and chaos, and feeling like that feeling of desperation. Notice if you feel desperate as well. It's transferring across into your experience, and then taking that step back, diffusing back from that ourselves, so that we can keep seeing the whole picture. Rather than getting stuck in the painting, we're observing the painting as it's taking place. Absolutely. And remembering that actually the skill is not necessarily being, and one of the things we talked about was away and towards moves. The skill itself is not necessarily just being able to write a long list of away moves and a long list of towards moves. The skill is being able to see the choice point. That's the process that we're trying to facilitate here, that there's a choice, and that there's an autonomous choice, and that there is one that is in service of a particular value, which might be around personal health, personal sleep hygiene, personal joy, all of that kind of stuff. And then there might be one that's pulling in a value that's conflicting, but that's actually pulling in a different direction. And we're trying to figure out what is that choice point, and facilitate the voice and the ability and allowance of somebody to be able to choose, which probably means they have to take discomfort from one realm of their like sort of quantum matrix of self. So they'll have to take discomfort from one realm and into another, and it's making that choice that's difficult. Nice. Yeah, good luck.
Thank you.
And would anybody like to feedback from one of the other groups? I think there's 2 more groups, but maybe we've only got time for one, so if anybody has something that they particularly want to share.
I think I can be quite quick actually, so probably the other group would still have a chance. I was in a group with Vowles and Veronica, and none of us, or between us, we didn't have a patient that we're discussing, and Vowles was quite new to ACT. So Veronica and I feel did very well at trying to explain what ACT is to Vowles. So we kind of discussed the 6 facets, and we sort of put in, and then we talked about how it might fit into our experiences so far and our future work. So yeah, that's kind of what we did. We didn't particularly discuss a patient, but it was very useful for reflective purposes from a theory point of view.
Yeah, it's an ongoing learning process, isn't it? Like, what is ACT and what do I think it is, and how do I enact it, and how do I bring it into my practice? Yeah, lovely. Always helpful. Does anybody have anything else they want to share, or any more questions that have come up that they want to explore? Now is your opportunity.
I would just want to say thank you. I didn't realize what I would get out of it just by speaking it out loud with other people. I think it could be a bit isolating when you're trying to work it all out yourself, and you don't, especially if you don't have a colleague that you can bounce it off. So I found it really helpful.
I was just going to add that I'm doing the Act for Beginners course in February with, I think it's the Russ Harris course.
Yeah.
On the 4th and the 11th of February. So I'll feedback after that if we're going to meet again.
Yeah, lovely. Please do. And it's always a good opportunity to get an overall insight into, you know, who is teaching on ACT and what are the other voices out there. Because like I say on my course, like if I'm the only voice that you're hearing when it comes to ACT, then you're missing the richness of other people's interpretations and other people's approaches, which might be useful in other ways. So yeah, absolutely. Just to add to that, I'm actually doing the Steve Hayes ACT immersion course at the moment, which is heavy, man. There's a lot of chapters in there, but it's also another course that you can do online, and you can run it alongside, you know, your work. You don't have to show up to live lectures like you do on mine.
And you find it useful for physiotherapists, that one, because I wanted to do it as well.
Well, I'm only in the beginning of it because it is quite a lot, and unfortunately it's hard when you've done a lot of ACT courses. You feel like the introduction sessions are a little bit hard to get through, so perhaps I need to do a little bit more self-practice on my own diffusion and sitting with. But yeah, I don't know, I think so. I think it's very psychologically based, but it's still also generalizable. So yeah, at the moment I think so. What I find, one of the reasons why I put my course together is because I wanted physios or non-psychologists to be able to ask the questions that are relevant to them, and also to be able to predict a little bit more what might be coming up and where the gaps might be in some of our training. Because if you're a psychologist and you've done 6 years of psychology, and then you'll have done your CBT training within that and lots of reflexive work, when you go on to do a 2-day course in ACT, like it's easy because you've already kind of done a lot of the groundwork for that. You're just updating. But for us, I think sometimes we actually have to go back and plug some of the gaps. And that's what I think that's why I think it can be helpful to do one that's been specifically, that is being run by someone who's walked that path, as opposed to just being delivered by psychologists. But I think it's all useful. And once you get more and more au fait with ACT, going into the more psychologically heavy ones is useful.
Laura, do you have a recommendation for kind of where to start if you want to practice a bit of ACT on yourself? I mean, you know, I have some books and things, but is there any particular sort of online course for a beginner, bit of a beginner like me?
I don't want to be like, come to my course, but come to my course.
Okay, so if I look on your website, I'll find it. Yeah, okay.
Yeah, but like there are others. Let me have a think. I'm just thinking who is actually running an online course at the moment. I think the PPA are doing some stuff. So the Physio Pain Association. I don't know if you can join that as an OT, but you can certainly get in touch with them on Twitter. They're pretty open and generous. So I would definitely get in touch with the PPA because they are running some. Because I know that my old colleague, Claire Jacobs, who works at St Thomas's, she's been doing some lectures recently. So that could be a place to start as well.
Okay, also, thank you.
Yeah, you know, just sort of find your people, find a group of people that you can talk to, and hopefully this will become one of those places.
Yeah, great, thank you.
Matilda, I can see your hand up, and then I think we're probably going to have to call it a day soon. I'm sorry, I don't want to take any more. If you need to hop off, that's fine. I'll send you the course, the link to the recording from this small session, and any of sort of like the 2 papers that I mentioned earlier on, if you want to read those as well. So if you need to pop off, that's fine. Matilda?
Yes, it's a question about 2 minutter. My son just walked in. Yeah. Vent, gå lige ud. Gå lige ud. Ja. Nej, gå lige ud, for jeg skal lige til at stille spørgsmål. Gå lige ud. Sorry about that. No, I'll just, because I've been trying to look into ACT in my own language, which is Danish, or Swedish, because I'm bilingual. And I find it really hard to find someone who is engaged, who does that kind of course that you did, Laura, because it's a lot about psychology. And what I found online so far was also very much about, sorry to say, it's a bit more, oh, let's all be happy and this is going to be life-changing. And I kind of hate that coming on as something, oh, if you just do this, then the world will be perfect, because I think it's a bit more complicated and complex. And I think, would you recommend doing different kind of courses in ACT to get a more nuanced way? Or is it okay to go in a more not okay, but having pain as a theme, because I'm not going to be a psychologist.
Mm-hmm.
Do you understand my question? I mean, is it too specialized to only go for ACT for pain? Would it be a good recommendation to go broader?
Going to a psychology delivered course, the likelihood is you're going to be seeing psychologists that are not just working in pain. So they'll be drawing in on their experience from a more wider perspective. So I think that's absolutely fine. I personally think it's always a good idea to be sampling different voices within the ACT community. But at the same time, I also think once you've done one course, there is a nice opportunity there to just stick with that one idea, that one voice, and then sort of develop it a little bit, and then maybe try something a bit further on. So that's why it is possible to find supervision sessions. So like I do some supervision, private supervision with people if they want it, and that can sort of like just run once a month, sort of a dedicated slot for you to just discuss your particular cases and what you're struggling with. But I do think, personally, I don't think there's any problem at all with going to psychology run courses, and if they specify that it's for pain, great, because you're going to get more user-friendly examples, and you're probably going to get more metaphors that have been sort of seem to work more in a pain environment, so that would be good. But yeah, I think it's just an opportunity to just try. Like, I have never been on an ACT course and thought that was a waste of my time, ever. Hello. so yeah, I would just get out there and give it a go, and you know, like I say, for me anyway, the most important thing has been to find your people. So find a group, find a place, whatever it is that where you feel like you can just discuss your cases, because if you're working on your own, you're probably taking the burden of that sort of like feeling overwhelmed and not knowing where to turn and not knowing what to say next, and it can be just so liberating to just give it some air amongst a group of people. So hopefully that's been useful and helpful, and like I said, we're going to do this at least every quarter, but if it looks like people want this more and I can find a space for it in my diary, I'm happy to host it more often. I wasn't sure how much people would want this, so that's really lovely that you're all here. I'm going to share one last thing, because obviously whilst I've got you on the line, it is an opportunity for me to say I do teach in a more sort of specific way. So if I can bring us through here, we'll just give you some more information. So there it is. That's my one terrible slide. It's full of lots and lots of information, but that's my course. It's a 4-week training program where we spend 3 hours every week just in a dialogue, process-based exploration of, you know, acceptance and commitment therapy, relational frame theory, sort of what it is to be in contact with each other and what it is to support somebody going through distress. So there's a huge amount of content that is delivered in a sort of short space, really, but because we're doing quite intense work for those 3 hours, you will feel it over the next week. Because it's dialogue based, every single course is unique, so it really depends on the group that comes in, and we really spend a lot of time trying to get to know each other so that we can target the right kind of information for you and where you are in your practice. So hopefully, if you found this useful and you like the way that I talk about ACT and you want to come along, you know, that's how you can get involved. That's how you can join. I'll be doing another ACT together at the end of March, so hopefully we will see each other again then. And also next month I will be giving a free webinar on, you know, this sort of phenomenological approach to the development of we. So what is it to have a therapeutic alliance, and how do we integrate that into our practice? So you are very welcome on that as well, and I will be plugging away my little course as well because hopefully we can spread awareness and just keep increasing access to ACT. So hopefully this has been useful. If you want to carry on the conversation, please do feel free to get in touch, email me or whatever, and I will see you all hopefully in a couple of months. Have a wonderful end of year break, however you celebrate this time of the year. I hope you enjoy it, and I will see you all on the flip side.
Thank you.
Thank you, Laura. That was great. Thank you. It was
Thank you.
Thank you, everyone. Bye-bye.
Bye.
Bye.
Bye. Bye. Bye.